But it's wonderful for senior citizens if you think about
Absolutely.
it.
Absolutely.
To have so much happening that they have access to.
Yeah. Yeah.
Whereas
webinar is new pandemic.
Sorry, Dr. Suhas?
Webinar has become a new pandemic now.
It is actually, yes. But some of it is in a good way, perhaps not all of it, but yeah. Ask a couple of people to read that properly. It's not coming on. Yes. I was going to use a different device, and then I suddenly realized that I connected on the one that didn't have enough charge. So anyway, now I've remedied that. So Satish, are we going to give people a few more minutes?
Yes, sir. Maybe another couple of minutes, then we can start.
Okay.
Because we have 45 attendees as of now.
Thank you.
53. Yeah.
Okay. Thank you. So maybe we will get going, and I'm sure that our friends will join us as we go along. Good evening, everyone. This is Dr. Krishnamurthy from Buddhi Clinic, and we are very happy to welcome you to this webinar, which really is probably one of those things that was waiting to happen. Discussion from Ayurveda to precision medicine, the two ends of the Alzheimer's and dementia care spectrum. In fact, I would say understanding and care spectrum. And we are very happy at Buddhi Clinic to be the ones bringing this to you. World Alzheimer's Day is marked on the 21st of September every year. And we are doing this on the eve of World Alzheimer's Day to bring a different perspective and thought process about Alzheimer's disease. We live in an era where we are very focused on the neurobiology of the condition, and we are very focused on the new treatments. And we have with us Professor Madhav Tambisetti, who is Section Chief Clinical and Translational Neuroscience Section in the Laboratory of Behavioral Neuroscience, Department of Neurology, Johns Hopkins University. He is also part of the National Institute of Aging, National Institutes of Health. Madhav, welcome. He's an old friend of Buddhi Clinic. He's been part of our previous programs.
Thank you, Krish. It's a real pleasure to be here. Thank you for the invite.
Thank you. Thank you for taking time. And I know it's a very odd hour for you. So we do appreciate your effort. Thank you so much.
Not at all.
And we have to balance, the age of what happens to the brain and mind as we get older and how to deal with that. We have Professor Suhas Kumar Shetty, who is Professor and Head, Department of Manovijnana, Avu Manasaroga, Sri Dharmasthala Manjunatha College of Ayurveda and Hospital. Welcome, Professor Suhas Shetty. Very, very happy to have you here today and very privileged to have you today. So,
Thank you, Dr. Krishnamurthy, sir. A very good evening to all of you.
thank you. So today's discussion is really going to be a little bit about how we are thinking about Alzheimer's disease in this era, and how we used to think about it, how the ancients thought about it, and how we can bridge some of these pieces of wisdom from both ends and bring them, integrate them into a common whole, so that we are able to do more for people with Alzheimer's and dementia, and indeed even to prevent the development or progress of Alzheimer's and dementia. And that's really the thrust of today's conversation. So welcome to all of you. Thank you for joining us. And we'll start off now by asking Madhav first. Could you tell us what Alzheimer's disease is, Madhav, and how it differs from dementia?
Very good. So, Krish, again, thank you for this invite. It's, as always, a real pleasure to be with you and participate in these public awareness programs. I've always enjoyed the way you've organized these events, and I consider it a real privilege to participate. So the term dementia is a general term that is used to describe individuals who have difficulties with memory, difficulties with thinking, difficulties with problem solving, judgment, orientation, etc. So difficulties with any aspect of what we would call cognition. And with these difficulties being severe enough to affect their day-to-day functioning or independent functioning. So dementia is a general term for memory disorders that are severe enough to cause an adverse impact on an individual's independence. And within that broad term of dementia, we recognize that there are specific diseases that can be included, that can cause dementia. And among these diseases, the most common type of dementia is dementia due to Alzheimer's disease. And we recognize that Alzheimer's disease is the predominant cause of dementia worldwide. A less but often overlooked cause of dementia is vascular dementia, which is the type of dementia you get because of brain damage due to things like small strokes over a period of time, some of which may not even be symptomatic or recognizable. Other types of dementias include dementias due to Parkinson's disease. There's a type of dementia called frontotemporal dementia. Another type of dementia is Lewy body dementia. So there are these various specific types of diseases that can cause what we would call dementia within a larger context and an umbrella term describing people with memory problems due to a variety of specific causes.
Thank you. And since we are marking World Alzheimer's Day, can I ask you what causes Alzheimer's disease in particular?
So I'm somewhat embarrassed to say that even though we've studied this disease now for more than 100 years, so it was in 1906 that Dr. Alois Alzheimer, who was a German psychiatrist, described the disease. So he took care of a lady in her early 50s who had profound problems with memory and went on to develop significant behavioral symptoms as well. And Dr. Alzheimer took care of her for about a year. And then when she died, he had the opportunity to look at her brain under the light microscope. And he described the pathological features of the disease and the clinical symptoms of the disease. And this disease now bears his name. So the first case report was published in 1907. And since then, we have learned a tremendous lot about the disease, about what we think the underlying biology of the disease is. But if you ask me what causes Alzheimer's disease, the honest answer is we really don't know. We think there are several genetic risk factors that greatly increase an individual's risk of Alzheimer's disease. We think there are several environmental factors that again increase the risk for Alzheimer's disease. The most obvious risk factor for Alzheimer's disease is, of course, increasing age. This is a disease of older individuals. The typical age at onset of Alzheimer's disease is after 65 years. So we think there's a complex interplay between genetic risk factors, environmental risk factors that eventually lead to the manifestation of typical Alzheimer's disease pathology and leading to symptoms of memory impairment. But we don't really know the precise cause for Alzheimer's disease.
Thank you, Madhav. That's a very clear explanation of both dementia, the different types of dementia, and how Alzheimer's disease is perhaps the most prominent form of dementia that we're dealing with, and hence the World Alzheimer's Day. Suhas, let me ask you, Ayurveda is a medical science, and medical science that dates back centuries. Would you like to tell us how the ancients regarded the brain and mind? How did they think about it?
Yeah. So, see, basically, if you look at how Ayurveda looks at the individual, it's a component of the 4 basic factors. Like it's a conglomeration of the body, the mind, the sense organs, and the soul. So whenever we talk about health, disease, management, we take into this 4 spectrum of management. So, but they're not a compartmental differentiation. Always there is interplay or sequential connection between all these 4 components. And that is how Ayurveda always looks at the health or the disease. So it's a conglomeration of the component of the somatic part, which is more of a bodily part. And we have the psychological and emotional part, which Ayurveda regards as a very vital, just something beyond the body. So we just also have the special recognition of the sense organs, like both the motor sense organs and the sensory part of the body. And then like there's something just beyond this is the consciousness or the spiritual aspect of the body. And so whenever we want to address or we want to look at the domain of health, disease, or the management, so we always consider this basic component of the body, mind, and the soul component, which is a continuum and interplay between all these components. So understanding this, because understanding the body may be easy, or maybe compared for a physician or a clinician, maybe based on the basic physiology or the functional component may be easy. But if we go a little beyond that, understanding the psyche or understanding the emotional aspect of the disease is a little bit more tougher than this. But as Professor Madhav was referring, that there are not much which is known to us. That is what Ayurveda also feels, that pratyaksham hi alpam. What we know about the individual or life is very less. And what we need to explore is much, much beyond that. And that is why when we sometimes say, sometimes when we interact with the patients, we always find that there is something beyond bodies. We are finding some pathology and something that is even beyond the psychological sphere that we are trying to address these issues. And sometimes we are exactly maybe identify the cause and effect phenomenon. So that is where probably we feel that I think there is something much, much beyond what we are trying to address as an individual. So to address all this, basically Ayurveda talks in terms of the basic humors, which is called as Vata, Pitta, and Kapha. And each one of these basic humors has its own actions in terms of getting the basic transformation, basic metabolism, bringing about the stability to the body. Each one of these doshas has its own role to play. And also they are dominant in particular age-related sequentially. Like for example, the child is dominant with Kapha dosha, adult is the dominant with Pitta dosha, and the elderly is dominant with Vata dosha. So there is something called as normal aging. There is normal aging, which is a physiological phenomena. Whereas when it comes to the abnormal aging, where profound manifestation of the cognitive decline happens. So that is where probably we consider that there is a cognitive declines. And this is called as prajna. In Ayurveda, the whole of the cognition is called as prajna. And there are 3 basic components of prajna: the dhi, riti, and smriti. Dhi is the ability to perceive. The Dhriti is the ability to differentiate between good and bad and maybe make the right choice. And the Smriti is ability to recall. So all this together is called as Prajna. And it is said that the impairment of these three components is a basic cause for many somatic and psychological functions. And that is a main key factors which is affected in cases of Alzheimer's dementia. So basically, that is how the Ayurveda looks at the body and mind. And there's no specific relation with the brain as such, but it has been mentioned as a vital organ of the body called as marma. And they say that if there is marma is getting affected with the exogenous causes, there are some symptoms. And if this marma, the shira marma is affected by the endogenous causes, there are the symptoms. But as such, the brain is not mentioned, but we get a reference of the shiras as a vital organ which can be affected by both exogenous and endogenous causes. So that's it, Dr. Krishnamurthy.
So you told us about brain, mind, and soul. You also said something about Smriti. I didn't quite get that, the three things.
Yeah.
Can you please repeat that again?
Yeah, sure. See, the whole of this cognition component is called as Prajna or Buddhi in Ayurveda, which has three basic components. It is called as Di, Dhriti, and Smriti. So Di is an ability of an individual to differentiate what is right and wrong. It is called as Ya Buddhihi Nishchayatmikam, the ability to differentiate the right and wrong. Ya Buddhihi Niyamatmikam is Dhriti, like its ability to retain or make the right choice is the Dhriti. And its ability to recollect whatever you have. It's like it's a basic, like you can say it's like input, processing, and retrieval. So these three together is called as Prajna. And there are three components. And that is what can happen in case of all these three components get affected in Alzheimer's. Predominantly, the ability to recollect and recall is what is mainly affected.
You also have a great focus in Ayurveda on the individual, the Prakriti. So could you tell us a little bit about the personalized aspect there?
Yeah, I think this is what makes Ayurveda so unique because it addresses the individual as it doesn't like all standard do not fit an individual. No? Like each one of them has its own way of addressing. And there are so many variables that we talk about. And there are at least 10 variables that we need to consider as a clinician whenever we want to address any patient. So these 10 factors are Dushya, Desha, Bala, Thala, Prakriti, Agni, Desha, Thala, and the stage of the disease. So Dusha refers to different bodily tissues, and basically Ayurveda focuses on 7 major tissues of the body. Then Desha refers to the place or like different seasonal variations that can happen. Then the Dusha, Desha, Bala. Bala refers to both the physical stamina as well as the psychological stamina of an individual. Okay. Then we have the Dusham, Desham, Balam, Kala. Kala refers to the time. So it could be the daily regime, or it can also be the age. It could be various aspects of the influences of the external environment, which can be talked about. Then we have the Prakriti, which is a physical and as well as a psychological components. See, basically there are like the 7 basic Prakritis. In case, again, this Prakriti is of 2 types. One is the bodily Prakriti, other is the psychological Prakriti, what is called as Sharirika Prakriti and Manasika Prakriti. So based on the permutation combination or based on the important physiological features, we classify into 7 basic types. Again, it's based on the permutation combination of the type of doshas. Like individual, we have 3 doshas, like we have Vata Prakriti, Pitta Prakriti, and Kapha Prakriti. We make a dual combination of these 3, which again adds up to 3 more types. And the 7th type is where all 3 doshas are combined, coming to the 7th type. So this is the somatic Prakriti or the physical Prakriti or physical constitution that we talk about. Similarly, we have the combination of the psychological humors. See, just as we have the humors for the body, we also have the basic humors for the mind, which is called as Sattva, Raja, and Tama. where sattva is said to be that which is not cause any disease. It is like a purest form of the components, whereas the other two are ability to cause the disease. That's why they are called as doshas. And here also we make again the psychological constitution or psychological prakritis of 16 types, where there are 7 subtypes of the sattvika prakriti, the 6 subtypes of the rajasika prakriti, and 3 subtypes of the manasika prakriti. So
Thank
totally,
you.
yeah.
Thank you. So I think that there's quite a bit of detail there for a non-Ayurvedic doctor or a non-Ayurvedic person to absorb. But it's wonderful that there's so much thought that has gone into it. Madhav, I wanted to ask you, there is a concern today that dementias and Alzheimer's disease are achieving epidemic proportions. I know we're in the middle of a pandemic and we are all preoccupied with COVID-19, but of course, chronic diseases like dementia and diabetes are constants. Can you tell us a little bit about this? What is the reason and what are the implications for low and middle income countries?
Sure. So according to the World Alzheimer's Report, which was commissioned by the Alzheimer's Disease International, this was a report that was published in 2015. It was then updated in 2017. And according to this report, there are more than 55 million people worldwide currently living with dementia. So it's a staggering number. And what is even more worrying is that projections are that this number will double approximately every 20 years. So by 2030, we estimate that the worldwide prevalence of people with dementia would be about 78 million. And by 2050, this number will reach 140 million. So these are huge numbers. What is perhaps even more worrying is that most of this increase in the dementia numbers over the next 10, 20, 30 years are going to be in developing countries. So at present, about 60% of people with dementia live in low and middle income countries. By 2050, we think this number is going to increase to more than 70%. And the fastest growth in these numbers is going to be in countries where the aging population is projected to increase dramatically, which is essentially India, China, South Asia, and countries in the Western Pacific. So these are the global prevalence estimates of dementia. But what is also interesting and something that I think is complementary to the theme that you've chosen for today, Krish, is that when you look at the incidence of dementia, and here the technical term that I'm going to introduce here is incidence. Incidence means the number of new cases of dementia that are being diagnosed, as opposed to prevalence, which refers to the number of cases already existing. So the numbers that I just gave you of 55 million are current prevalence estimates. These are people currently diagnosed with dementia or suffering from dementia. But when you look at incidence rates, which is the number of new cases of dementia that will be diagnosed in the years to come, there's a very surprising observation. So in now several studies that have been reported from the United States and from Western Europe, it looks as if the incidence of dementia since the 1930s and 1940s has in fact decreased. And so this is a very interesting observation, and we really don't have a precise explanation why this is the case. We think that this might be because of general improvements in healthcare in these countries, especially an increase in cardiovascular health and cerebrovascular health, prompt treatment and recognition of high blood pressure and diabetes, increase in social and economic conditions, including educational attainment, a general tendency for smoking to have decreased. So we think there are these general lifestyle factors, general health improvements in the United States and Western Europe that have also contributed to a lowering of the incidence of dementia and Alzheimer's disease. So I think there's a message here for people in low and middle income countries as well, that the incidence of dementia can in fact be decreased, potentially by general improvements in healthcare, general improvements in cardiovascular health, and socioeconomic factors. So I think that is a note of hope that we should all take some measure of reassurance from.
Thank you. So there is alarming news that we have a huge burden of cases with dementia, and that is going to grow exponentially with time. At the same time, there is good news that if you do take care of yourself, both individually, as a family, as a community, as a society, then it's likely that the new cases of dementia in each community will come down rather than go up. And so over time, it will be more manageable as a condition, hopefully. I presume I've summarized that reasonably well.
Absolutely, absolutely. And I think, as the discussion progresses, we might get into what these modifiable risk factors may be. And I think that's an important consideration as well.
Absolutely. Thank you, Madhav. Suhas, I wanted to ask you, so have we lost Dr. Suhas? Not able to see him in the panel.
Yes, sir. Calling him, sir.
Okay, we will continue to talk, Madhav. We should probably go on to talk about lifestyle and disorders because it brings us neatly to that. Can you tell us about this emerging discourse about the importance of lifestyle and disorders of lifestyle as being responsible for brain degeneration in old age, how that's contributing to our understanding of dementia, and can you trace that relationship for us?
Yeah, so this is really an important question, and I think this is something that patients that I see are often concerned about, both for people with current symptoms of dementia, as well as their family members. So how can I prevent, or what can I do today that will change or lower my risk for Alzheimer's disease? And there's now emerging evidence that more than a third, or about a third, of dementia and Alzheimer's cases may be attributed to 6 or 7 modifiable risk factors. And these risk factors include diabetes, midlife obesity, midlife hypertension, a sedentary lifestyle, lower levels of physical activity, depression, smoking, poor levels of educational attainment. And so these are what we are beginning to recognize as modifiable risk factors. And many of these are also associated with lifestyle. And for example, a sedentary lifestyle goes with lower levels of physical activity. It predisposes to hypertension. It also is associated with other poor lifestyle choices, perhaps like high alcohol intake, smoking. There's increasing recognition that inadequate sleep may in itself be a risk factor for Alzheimer's disease. In older individuals, decreased hearing contributes to poor social interaction, which again is a risk factor for Alzheimer's disease. And so now that we've recognized that there are these modifiable risk factors, we can now start thinking about what types of interventions and what types of guidelines we might prescribe to our patients, as well as those individuals who want to lower the risk for Alzheimer's disease who currently don't have these symptoms. And so the recommendations that we think might be useful are to increase levels of physical activity. And the current recommendations are about 150 minutes of moderate physical activity every week, to make sure that at midlife, especially, you get a good control of body weight as well as hypertension. Recognize symptoms of depression in older individuals and make sure that they are promptly treated. Recommendations for diet, again, are beginning to emerge and showing clear relationships with cognitive health. And these include diets low in red meat, mixed in fruit and vegetables, plant-based fats, low consumption of dairy, low levels of sugar. Limit your sugar intake to less than 50 grams a day. Limit salt intake to less than 5 grams a day. And there's never a better time to stop smoking than now. Limit alcohol intake. So all of these are modifiable risk factors and lifestyle changes that people can make today to decrease their risk for Alzheimer's disease and dementias.
And can I ask you about the Mediterranean diet and the mind diet?
Absolutely. So the Mediterranean diet comes from countries like in Greece, where you have individuals that appear to be at lower risk when exposed over several years to diet that again includes legumes, whole grains, moderate amounts of alcohol like red wine, increase in plant-based fats like olive oil. And we think these complex diets have a protective effect on brain health. We don't know exactly what component of the diet it is that confers this benefit, but we think it is some combination of all of these factors that results in a lowering of risk for dementia, as well as specifically Alzheimer's disease, as well as promoting health. There are some clinical trials now that have started looking at this in a more objective way. One of the most famous such studies is the FINGER clinical trial that was led by investigators in Finland. And this diet, again, included some components of what you refer to as a Mediterranean diet, including a rich mix of fruit and vegetables, plant-based oils. And they found over a 2-year period a significant benefit in terms of cognitive function, not just in memory, but in multiple other cognitive domains. So I think there's still some work to be done in identifying the precise mechanism of these complex diets. But I think the evidence is emerging that they clearly have a neuroprotective role to play.
Thank you. Dr. Suhas, I wanted to ask you how did the ancients regard our relationship between body and brain health, and what bodily factors in Ayurveda science are identified as contributing to poor brain health or a decline in mental health? Could you tell us that, please?
Sure. See, basically, when it comes to the brain health or the basic health of an individual in terms of their general cognition, the important factor that has been emphasized is on the diet, the lifestyle, and of course, there are various other therapies and herbs which has been emphasized as not only as a curative measure, but also many of them have been emphasized as a preventive measures. So in terms of the diet, there have been specific which are called as medhya. They have used a word called as medhya. So those which are good for medha, all those which are good for medha are categorized under medhya. Like it includes like water, milk, ghee, and there are some specific fruits and vegetables which have been emphasized, and they have said that they are very good for brain. Like one of them is the gooseberry, which is commonly used. Then we have the raisins, which is also very commonly used. And one of the very common vegetable which has been emphasized as very beneficial for the brain is the ash gourd. Ash gourd is said to be very, very beneficial in terms of the brain health. And it is said to be one of the best for the brain health. So what they have advised is to make this ash gourd into maybe 8 to 10 pieces and take the pulp along with the seeds, crush them and make the juice out of this. And this should be consumed around 40 to 50 ml twice a day, either with honey or sugar candy. And if one can use this at least for 6 to 8 weeks, it can improve their brain health. And that is why there is a tradition in Indian culture that very commonly whenever there is some very happy events or there is some sorrow, no, they use this in the, like housewarming also, they use in cremation also. Maybe with a symbolic that it is a very good stress adaptogenic. It is like there have been very researchers which says that the ash gourd which is consumed along with the pulp and the seeds is said to be very potent brain tonic, and also it can be, also has a very potent antidepressant action, and also it induces good sleep also, which is again one of the very vital component of a brain health. And that is where Ayurveda talks about the 3 basic tripod. It is the diet, sleep, and ethical living. Ahara, Nidra, and Brahmacharya are said to be the Trayopasthambhas, which are said to be the supporting pillars of an individual, which can maintain the health in general and mental health in specific. So if one can take care about these three basic components, I think definitely, and also there is something called a seasonal detoxification, even for a healthy individuals. Like basically, we can identify some basic symptoms in a body, like suppose a person has recurrent mouth ulcers, recurrent skin rashes, recurrent cold, recurrent joint pains. It means that they are dominant with some particular dosha. Like for example, recurrent cold cough means they are dominant with kapha dosha. Recurrent skin allergies or some rashes, it means that they are dominant with the pitta doshas. And suppose they are always getting some joint pains or aches, etc., it means that they are dominant with the vata doshas. So such people can do a preventive detoxification therapy, which are called as panchakarma, which are the 5 basic therapies which have been done, not only for the disease management, but also as a preventive modalities of treatment, at least once in a year. If one does this on a regular basis, it can be like, we give our vehicles for service. We can also get our body serviced by these therapies.
Thank you. It's so evident that many of the risk factors that Professor Madhav identified for us are addressed in a preventive fashion in what Ayurveda already prescribes as being important for good health and good brain health. He talked about sleep, he talked about lifestyle, he talked about depression, diet, all these as being contributing factors to brain degeneration. And it's very interesting that many, many years ago, this has already been thought about in the tripod. We will come back to that in a moment. I wanted to ask you, since you mentioned herbs, and you said herbs can be both preventive and curative, would you like to tell us what are the herbs that are prescribed for good brain health and for improvement in memory in Ayurveda?
Yeah.
Yes, doctor, we can hear you.
Yeah. So basically, when it comes to the brain health, there is a huge list of the herbs. Either they're used as single drugs or they're used as a single polyherbal combinations. And even there are some mineral combinations, like the herbo-mineral combinations, which has been said to be beneficial for the brain health. So I'll just mention a few of them, which are said to be very, very beneficial. The first and foremost is called as Brahmi, Bacopa manoria, which is having the anxiolytic, antidepressants, and acetylcholine inhibition, tranquilizing, and especially good in learning and memory. And it also is a potent anti-craving properties of that. Then we have the Shankapushpi, which is Carnales puricalis, again, which is potent antioxidants. And also it is said to be neuroprotective in nature. And the most important thing is there has been study which says that Shankapushpi has a potency to remove the amyloid plaques and the tau aggregation, which is the basic crush of the pathology of Alzheimer's dementia. We also have something called as Guduchi, Tinospora cordifolia, which is said to be potent in case of enhancing the cognition, learning, and memory. We also have Manduka Parni, which is Centella asiatica, which again is said to be very potent in removing the amyloid plaques and tau aggregations, and also very good for inducing good sleep. And one of the very sought out drug which has been extensively been researched is Ashwagandha, Withania somnifera, which is said to be stress adaptogenic, neuroprotective, and also it has NMDA antagonistics, dopaminergic removal of the amyloid plaques and tau aggregations. And as I also mentioned about the ash god or Binankesa hespida or Kushmanda is also a potent anxiolytic and antioxidant drugs. So these are some of the single drugs. There are plenty of polyherbal drugs, and specifically there are two formulations or two drug forms. One, which are in the form of the ghee, or what we commonly call as the clarified butters. And other one is in the form of the asava aristas, which are the alcoholic preparations. So it was very, very scientific that alcohol-based preparations and lipid-dominant preparations are said to be very, very commonly prescribed for the brain health. And that is why most of the formulations which are used for mental disorders and old age related disorders are dominantly of either the ghee-based preparations or the alcohol-based preparations with the intention that they can act on the blood-brain barrier and bring about the effective changes in them. So these are some of the commonly used herbs which they have mentioned in Ayurvedic text and which also have been extensively been researched across the world for its potent action in general and specifically in cases of Alzheimer's dementia.
Thank you. Madhav, may I ask you, what are the treatments for Alzheimer's disease and other dementias that are available to us today? And, I'd also want you to tell us what you think is going to emerge. I know you're very actively researching a lot of what is happening in Alzheimer's. What's going to emerge in the next 10 years as possible treatments?
Right. So as of last year, we had 4 symptomatic treatments for Alzheimer's disease. And the last of these was approved by the FDA in 2003. And these 4 drugs consist of 3 acetylcholinesterase inhibitors, and a 4th drug is called Namenda or memantine. And these are merely symptomatic treatments, which means that they do not alter the progression of the disease. They do not modify the trajectory of the disease, but they might provide some symptomatic relief and some modest slowing of symptoms over a period of time. So we really don't have any true disease-modifying treatments for Alzheimer's disease. But as of June of this year, there was a very, very controversial approval of a novel drug for Alzheimer's disease, which is a monoclonal antibody called aducanumab, made by a company called Biogen. And this was a very, very controversial approval by the FDA. And this drug is now approved as a treatment for Alzheimer's disease. There are lots of reasons why this was a controversial approval. I, in fact, was on the advisory committee to the FDA that considered the application for approval of this drug. And all members voted against approving this medication. One member was undecided. So there was an overwhelming consensus that there really was no sound evidence for efficacy of this medication. And that's why the advisory committee voted not to approve it. But the FDA decided that the burden of disease due to Alzheimer's was so enormous that there was such a strong unmet need for disease-modifying treatments that they felt that because this particular monoclonal antibody lowers the levels of brain amyloid, they felt that based upon this surrogate endpoint, there was a reasonable likelihood that this drug might result in cognitive benefit. So simply based upon this surrogate marker of lowering of brain amyloid levels by this monoclonal antibody, the FDA decided to give the drug a specific type of approval called an accelerated approval. And what this means is that because of this accelerated approval, this drug can now be prescribed to patients meeting certain criteria for Alzheimer's disease. But the company is obliged to provide real-world evidence for clinical efficacy of the drug. They have a long time in which to do this. So they have the next 10 years to collect data on whether this drug works or not. So we have a rather unprecedented situation where a drug has been approved not based upon its clinical efficacy, but based upon a surrogate endpoint of lowering brain amyloid. and based upon the hope that over the next 10 years, we will get data on the clinical efficacy of the drug. So added to these 4 symptomatic treatments that I've mentioned, we now have a newly approved monoclonal antibody against amyloid that has been approved by the FDA. What do I anticipate over the next few years? It's a very difficult question. I think based upon this particular approval, we would anticipate that the bar has been lowered considerably because the FDA has approved a drug based not upon cognitive benefit, but based upon lowering of amyloid levels. It's very likely that there are going to be many, many other companies with similar drugs that may not result in obvious cognitive benefit for patients with Alzheimer's disease, but that might do a very good job of lowering brain amyloid levels. In fact, a few months after the approval, there were 2 other monoclonal antibodies that the FDA has prioritized for review. And these are again drugs that lower brain amyloid levels very well. We do not know yet if they have any significant cognitive benefit. In fact, with the clinical trial data that we now have, it doesn't look as if these drugs have a dramatic or strong effect on cognitive endpoints. So over the next few years, I anticipate that more of these drugs will come up for approval. Whether they have any meaningful clinical efficacy or not, we don't know. But I think all of this just increases the need for us to pursue rigorous research, identify novel drug targets that provide real meaningful clinical benefit to patients. I think that is the take-home message for me as an Alzheimer's researcher, that we really have to redouble our efforts to try and identify effective disease-modifying treatments.
Thank you, Madhav. So we have shifted from symptom-based treatments to disease-modifying treatments, but it's still very much watch the space, with the disease-modifying treatments still being available to an exclusive group of people at this point in time. Thank you. I want to ask you, Dr. Suhas, that when you are confronted with a person with dementia, what is the Ayurvedic approach to treatment? How do you treat a person?
So I think it's a really a very good question that Dr. Krishnamurthy has just put forward. See, basically, when it comes to the approach towards a patient with the symptoms of Alzheimer's dementia, so basically we classify them into the basic stages of diseases that we generally classify them, like whether they're in the early stages of dementia or they're in the middle stage of dementia or they're in the late stages of dementia. Then, like, we have the 2 modalities of treatment, we treat them on an outpatient basis or community-based treatment. And then we have the inpatient treatment where we are putting them for various types of the therapies that we also talk about. So basically this treatment package, or treatment protocol that we can talk about will be a combination of the dietary advices, the lifestyle advices, and of course, the herbs that we have already mentioned about. I'd like to bring to the attention of all the participants about one such publication that we did as a group from our institution, where we have published called as the Rasayana Herbs of Ayurveda in the age-related cognitive decline, an updated review. Like, what are those probable herbs that are available in Ayurveda, which could be effectively be used in case of the old age cognitive declines. So in that, basically, I have put my original thoughts on that, how we could approach such patients. So what we basically came across is the earlier stages of dementia would be dominant with kapha, and the best herbs that we can use is the turmeric and the jyotishmati, Silastus paniculatus. These are the 2 herbs which we commonly use in the initial stages of the dementia, which is the first stage of dementia, which we call as the kapha dominant stages of dementia. Then we call it as the second stage, which is the pitta dominant stages. And we are using the herbs like Manduka Parni, Bacopa manoria, and Glycyrrhiza glabra. So these are the herbs which are found to be effective in the second stage of the dementia where there are some profound symptoms. And in the later stages or in the severe stages of dementia, we use like the gooseberry, we also use the Nardostachys jatamamsi, Tenosphora cordifolia, somnifera, Withania somnifera. Then we also use Canullus puricalis, etc. So these are the common herbs that we use in these cases. Along with this, there is enormous importance of using the therapies, which we call as the Panchakarma, and it includes both the external therapies as well as the internal detoxification therapies. The external therapies includes the body massage using various medicated oils like Shirabala Tela, Mahanarayana Tela, or even the Nirgundi Tela, etc., based on the symptoms and the dominant doshas. Then we also have different types of the specific therapies which are aimed at the head, just called as Murdni Tailas. Like we have the Shirodhara, the oil dripping, the Shiro Basti, where we put a like structure on the head, and the oil is retained for around 30 to 40 minutes, and they are subjected to different selection of the different types of oils. And when they are used, at least generally when the patient get admitted, we at least admit them at least once or twice in a year, at least for 10 to 15 days, where they undergo this. They also undergo something called as a medicated enema, which we use in combination called as the Basti, which also there are two types of the medicated enemas, the decoction based enema and the oil or the lipid based enema. So these are the different types of the therapies that we commonly use. And we have found that when we are using this at a very early stages of mild to moderate or the early or the middle stages of dementia, we are able to at least prevent the progression of the disease to marked extent, and especially improve their quality of life. I think very recently also we had one such patients where we were able to at least arrest their progression, which has been very significantly progressive for the last few months. So, but it is like a multimodal treatment which need to be used. And along with these basic therapies, we also advise the allied therapies like the yoga, meditation, pranayama, music therapies, chromotherapies, aromatherapies. So there are other specific therapies which we have been working upon. And we find that when we combine these with our mainline treatment, we get good relief to the patients, and the quality of the patients definitely is able to get improved. And along with that, sometimes because it can be very stressful managing such patients of dementia. So it's also equally important that we take care about the caretakers also. Sometimes addressing their issues are also equally important. So definitely the different types of the psychotherapies, both for the patient as well as the caregiver, will play a major role in the management of dementia. Thank you.
Thank you. Thank you. That's a very comprehensive approach from an Ayurvedic perspective, including herbs, including various treatments, including enemas, massages, and of course, with an emphasis both on promotion of health and prevention of decline. So I think that's it's very, very important that we think about this diversity that Ayurveda offers, and which is very widely available to us in a country like India. And I want this to be an encouraging message for many people who are listening, who may know sufferers with dementia. One often feels there's nothing I can do. I think the message is that there is quite a bit that one can do in order to improve, as a doctor pointed out, quality of life. So at Buddhi Clinic, we have this integrative approach that we've been following for several years. We've had the opportunity to develop and refine it. And I'm sure that for us, it's work in progress. We can get better and better and better. We believe in what we do. And I have with me our clinical director. It's World Alzheimer's Day, and I forgot to introduce her at the beginning of the program, Dr. Rama Raghu. who is the wind beneath the wings of Buddhi Clinic. And I'm going to request her to talk about one such patient and our integrative approach. And, what makes this particular thing interesting is that apart from drugs, apart from psychological therapy, apart from Ayurveda and naturopathy, this person also received neuromodulation. So it's a very interesting story. And I'm going to request everyone, our audience, to put their questions now into the Q&A section so that we are able to ask your questions to the speakers at the end of this presentation. Dr. Amarago.
Thank you. Is it visible?
Yes, ma'am.
Yeah. So good evening. So I'd like to start with a little bit about Buddhi Clinic, and we've been around for 12 years now. And I think it's essential that neurorehabilitation needs to be integrative in its approach of assessments and therapy, because we all know that neuropsychiatric disorders are largely very disabling, both physically and cognitively. And along the 12 years that we've been around, we have evolved a very seamless blend of cutting edge modern medical techniques, along with the ancient diverse medical traditions that we have heard from Professor Suhas as well. And we have managed to have it all under one roof very conveniently for our patients. And we've also understood that if we are careful in our assessments and we weigh the pros and cons and we look at what would be best suited to the patients, we are able to harmonize these approaches so that there is very good clinical impact for our patients. So Buddhi Clinic is all about integrative brain and mind care, and we focus on pain and disability, cognitive decline, mental health conditions, and lifestyle conditions. Because the patients who walk through our doors, they primarily come for brain and mind problems, but we also find that during our comprehensive assessment that they have very many issues with painful joints and muscles and digestive issues, gait and balance issues, etc. So there are lots of things in both physical and cognitive and behavioral domains which need to be addressed. And that is how our comprehensive assessment helps. And based on that, we are able to put together a multidisciplinary therapy program. And we have found that in most cases, we are able to make a very good impact, especially in improvements of quality of life and activities of daily living for these patients. So the program, the main program, of course, is the Buddhi program meant for brain and mind care. But like I said, they have a lot of other issues as well, which are multi-systemic. So we have the osteo program for the musculoskeletal issues. And then we have the digestio programs for improving digestion and GI health. And because of COVID, we have many patients with respiratory issues. So we're also taking care of that as best as we can, with autonomic issues as well. We have found several patients with these problems. We are also doing a lot of treatments for that. And of course, the lifestyle issues that Professor Madhav was speaking about, we need to control them better. We need to help them make the right choices so that their diabetes and hypertension, heart disease, etc., are better regulated. So we have a basket of therapies, actually spoiled for choice. You can see they're on the right. The cutting edge neuromodulation, we have the transcranial direct stimulation, which we'll be talking about when I discuss the patient. So that is a little machine which travels to the bedside of the patient. It can go home, hospitals as well. So it's very user friendly, and it has made great impact because of the way it is. And then we also have the transmagnetic stimulation, which does not go to the bedside. The client needs to come to it. And then the latest addition has been the transauricular vagus nerve stimulation that we're using for a lot of neurological conditions. And being a brain and mind care facility, we have the psychologists bringing in a lot of interventions from their end, the behavioral therapies, cognitive retraining, which is very relevant to patients with dementia, and caregiver counseling, hand-holding the family members who are very distressed because of all that the patient is going through. And then we have the speech and swallowing pathologists, and we have the physical and occupational therapists who do a lot for patients with physical disabilities, improving their quality of life. From the complementary and alternative medical treatments, we have the Ayurveda treatments. We do all external treatments. We haven't brought in the internal medications as well. We do only the allopathic medications along with these external treatments. So we have medicated oils and poultices and herbal pastes and very many other treatments as well. From naturopathy, we have yoga. We all know about it, how impactful it is. And it can also be used for patients with mild dementia, with the attender being in the room, observing what's happening so that it can be done at home. And then we have the pressure treatments, the acupressure, the acupuncture, the reflexologies, and the mud therapies, which we found are particularly useful for people with digestive issues to improve gut health. So the team which provides all these treatments, the lead is the allopathic physicians, the neuropsychiatrists, the neurosurgeons, and the general physician and the lifestyle physician. And then we have the psychologist from the mind lab, the physiotherapist from the mobility lab, and from the brain lab, we do the neuromodulation, all the treatments. The CAM lab, the Ayurveda and naturopathy doctors, and the therapy assistants who deliver all the treatments. And then the nerve lab, the electrophysiology assessments, which are done by the team there, and the speech and language pathologists who work to improve speech and swallowing. So to illustrate how we work, this is about an elderly general practitioner, a very well-known doctor who comes from South Tamil Nadu. And the family reported that he had a sudden onset memory issue in September of 2020. So he had a very active practice until then. He had a nurse he had trained very well to help him in his practice, and he had his patients coming in. He used to practice in the morning and in the evening. He was really busy, but from the onset of COVID, the family was very concerned about his health. He was a hypertensive and diabetic, so they told him to shut practice because they were in the middle of the first wave. So he was a person who was so passionate about his practice, and he suddenly had to give it all up. Quite an introvert. He does like to read all his books even now. So he starts his day with his medical journals, and most of the time he's doing a lot of reading and maybe a little bit of TV, etc. But he likes to spend time on his own. So with the practice vanishing and the sudden onset of memory issues happening, and he was assessed very well, and on the imaging he was found to have an infarct, which is called a single strategic infarct. And initially he had problems. He was very anxious, and he was also delusional in the beginning. And on the Addenbrook's cognitive assessment, we found that he had memory, attention, and visual spatial skill deficits. So based on our comprehensive assessment, we put together an intensive Buddhi program. So the lead, of course, are the allopathic medication. Like I said, we haven't put in the Ayurveda medicines. All the others are external treatments. So he was on his medications for his hypertension and diabetes. And from the Buddhi clinic, Dr. ESK added the Nootropill, which improves the blood circulation to the brain. And he had Memantine to improve the cognition. And he was on some supplements. And he was also on Donepezil in the beginning, but he had a lot of stomach issues. And he also had some skin rashes. And subsequently, in the last 2 weeks, he has dropped the memantine as well, saying he does not want to have any other medications other than his regular medicines. So in the first round of treatment, which he had with us, we had the neuromodulation, 20 sessions of the transcranial direct stimulation treatments. Each session lasts for half an hour. And then we had the mind lab sessions, the cognitive retraining. Of course, we had to talk to his spouse as well, because she's very worried with all the caregiving burden. And the cognitive retraining, we had 2 of us working on him, a psychologist, a senior psychologist, and myself. And between us, we did a lot of sessions, and I was focusing on a lot of medical stuff. And we used to discuss cases. It was literally a teaching and learning session, teaching for him and learning for me. So he remembered it was a very algorithmic kind of approach that he used to take. And it was very, very systematic, his approach. The way it used to be in the olden days, where there were very few investigations. So a lot of the treatment depended on the clinical acumen. So there he was. So everything was so nicely discussed and came to a very logical conclusion. So I just went back to my student days. So every session that we did medically, we did around 10 hours. It was every session had something for me to take away from, and it never changed. So his memory of his the medical stuff was pretty much intact. And we did some complementary and alternative medical lab treatments because he had some spasm in the lower back. So we did some focal abhyangam, which is a medicated oil massage. And we did some reflexology for his feet. So we did around 40 hours of integrated therapy program in the first intensive phase, as we call it, where he had treatments every day. And there were good improvements in the cognition, especially in the memory, where there were very obvious deficits. And he used to be very cooperative for all the sessions. He never refused to come for any. So there was a very good rapport. So just a little about the neuromodulation. It is a non-invasive and a painless intervention, and it modulates neuronal activity. So we identify what are the points that need to be taken care of. And 2 milliamps of intensity voltage is used. And for this patient, after 5 sessions of the regular TDCS, Mr. Vivek is our neuroscientist who delivered the sessions. So upon Dr. ESK's advice, we also put together the normobaric oxygen at 5 liters per minute, was given to him along with the transcranial direct stimulation sessions. And there is literature saying that people do very well when they are on both hyperbaric and normobaric oxygen. They do very well in terms of reduced headaches, improves memory, concentration, and sleep, and delays neurological sequelae as well. So I have a little audio clip about the CRT session that I did with him yesterday with his consent. So this is, so I just want to show you the context in which the audio clip will play out. So these are pairs of words that I use, which are antonyms or synonyms. So if it is an antonym, opposites, he has to say it's green. And if it is the pair of words is synonym, he says red. And we'll see how he does. So we have around 16 pairs of words. And the next, we have 2 pictures, and I asked him to spot the differences. So he looked at it and then he came up with all the differences. And I also do proverbs. He's very good in English. So I do proverbs with him, and I do math, little arithmetic sums. It really brings a zing into the session because his eyes sparkle. He loves the math part of it, especially when he cracks it. Puzzles, he's not very fond of. He usually calls his wife and asks him to help. And after we've done all the sessions, after we've done all the exercises, I usually do a recap. So I take him through this. And we also do comprehension passages. He loves music very much. So I show him pictures of old classical Carnatic vocalists. And he knows what songs they've sung, like M.S. Subbalakshmi, etc. And he's able to sing a few stanzas as well. So the old memories are really good. And yeah, so now I think I'll go on to the next slide and play the audio clip. Okay, so this exercise, you have pairs of words. You have pairs of words.
Yeah.
So the pair is either opposites or
right.
they are the same meanings.
For example,
Yeah.
above, below is
What color is it?
not
You don't have to touch it. So if it is the same, it is red. And if they are opposites, it's green.
this is a synonym.
Okay. So what is the color? So if they're same, you have to say it is red. And if they're opposites, then you have to say it's green. So now tell me this pair, above and below.
Okay.
What is above? What is that pair?
This is green. This is red.
Above and below, they're opposites. So opposite, what is the color?
Red.
No, it's green.
Green. Okay.
Same. If it's the same, the
Then
meaning
it
is
should be red.
red. That's right. So cap and hat.
So sofa and couch.
Yeah.
Both of them are almost same.
So what is the color?
Green.
No, it's red. Red. Yeah. Clean and dirty.
Opposite. Red. No, green.
Yeah, that's right. Dark and light. Yeah.
Green.
Yes. Awake and asleep.
Green.
That's right. Empty and hollow.
Red.
That's right. Fat and skinny.
Fast.
Fat.
And skinny. Opposite. Green.
Yes. Yell and shout.
Red. Same.
Yeah. So here you can see two pictures. You will have to find 5 differences between the pictures.
5 differences.
Yeah.
The cloud itself is different between the two.
Okay.
And the number of bees are different. There are 3 bees, only 2.
Yeah. Yeah.
And the flowers and the flower is green, is red.
No, there's no flower here. There's a flower here. Yeah. Yeah. 3. Yeah.
And look at the mushrooms.
Oh yeah.
They are
Bush
different.
here. It's bigger and smaller. That's right. Yeah.
Oh.
Yeah.
And
Dr. Rama, maybe you can show us the slide.
Yeah. Okay. So if I show the slide, I think I lose the.
Oh, you lose this. Okay, sorry.
Yeah. So I
that's
just.
That's okay.
It's like,
here,
yeah, it's not. Yeah.
all 5 differences.
So this is the father bear and a child, baby bear. Is it a father or a mother bear?
Oh. Looks like a father.
Father bear. Okay, and a baby bear. Okay. What about the faces of the bears? Any difference there?
Pardon me?
The faces.
This is mouth shut.
Yeah, this.
Sensible guy. This opens.
Okay. Fine. Okay, what about the mountains?
Pardon me?
The mountains. Any difference? The mountains?
Surrounding.
The mountains.
Oh,
Mountains.
Mountains are different. This is a beautiful mountain. This is all the different. You can see the moon coming up.
What is this?
Is it not the moon that is coming up?
No, this is snow.
Oh, snow.
Yeah.
Snow.
Yeah.
Oh.
Snow-clad mountains. Yeah. So those are the differences. So you remember the differences?
There are great number of
Yeah,
differences.
more than 5 differences. There are 7 at least. See the
This is
differences?
something which is my feel.
Yeah. Okay. I'm just coming back to this. So you got all the differences. Yeah. He's also retained his sense of humor. I think that's really nice. And there's another patient who's very fond of Rafi songs. So we actually do a little session of recording, of singing and recording. He also remembers the stanzas of the songs. He goes with the flow and he's really excited about that part of the session. So these are pictures of the CAM therapies that we use. So we use the Shiro Abhyangam, we use the Shirabala oil with patients who are restless, who need some calming to improve sleep. So we use we do the Shiro Abhyangam. We also do the Shiro Dara, which is a more elaborate treatment, where you have medicated oil dripping on the forehead. So this also helps in improving sleep and relaxing the person. And then the pressure treatments that we spoke about, the acupressure, the reflexology, and the mud packs, where a paste of mud is applied on the abdomen and left there for around 20 minutes. And it improves the blood circulation inside the abdominal organs and improves digestion and reduces constipation. So in most of our elderly, it's a very good treatment, along with virgin coconut oil that we advise from 20 to 40 ml. And we have very good feedback from families saying that it's working very well. We also do the lifestyle counseling for the patients. So I go through the daily schedule, and we encourage them to have activities planned for the day. We put it down. So the psychologists help with that. And we see that if they have a good schedule, the first part of the day, the rest of the day takes care of itself. So we see that there's a little bit of exercise, walking, exposure to sunlight, not being afraid of going to the terrace or outdoors. They can wear a mask and go. Most of them have been vaccinated. So the lifestyle counseling, along with the diet, like as Professor Madhav said, I think eating sensibly, eating on time, and having a balanced diet, all of that works well. We don't talk about alcohol here because, so they can just say the doctor told us, and then, so we don't really talk about the wine or the alcohol. But smoking, they know, we tell them it's a big no. So many of them getting off that. But on the whole, our patients do understand that having a good schedule of activity through the day is very, very important. Sleep, waking up time, sleep time, and everything else. And also socializing as much as they can, keeping in view of COVID and all its issues. But I think there's been a good connect virtually between the patients and us and the families as well.
Dr. Rama, thank you. We're kind of
thank you.
On time. Thanks so much.
Yeah. I'll stop sharing.
Yes, please. Thank you. So thank you so much for that. We'll just take a few questions from the chat and also from the Q&A. So I'm sorry. I think Dr. Suhas has answered many of the questions in the Q&A. And someone's asked about aducanumab. Madhav, I think you mentioned it briefly. And shall we say the jury is still out?
So yeah, I think we'll have to wait and watch and see what the real world experience with the drug is. We think that the 2 clinical trials have not shown conclusive evidence for clinical efficacy. We know that this is a drug with significant side effects. So 1 in 3 patients will have microbleeding. They will have reversible brain swelling. So we know that there is an established profile of adverse events associated with the drug, but without any clear clinical efficacy based on those clinical trials. So we'll have to wait and see, once the drug is actually widely prescribed, how patients do.
Right. Thank you. There's a question from Professor Srinivas Murthy asking about spirituality and how it delays the onset of dementia. Maybe I'll ask both our speakers to try and tackle that one.
See, basically,
please go ahead. Please go ahead, sir. Please go ahead.
See, basically, I think it's very important that we try to address this problem from all spheres, because basically addressing only body or only mind or only the cognition may not be sufficient. So that's why probably it's also important that you go a little beyond and try to emphasize on the spiritual component. see, spirituality is where you are trying to think just beyond the oneself, no, trying to think that we all are component of each other, and we all contribute the whole cosmic consciousness. And that is where probably when you indulge in a basic a kindness, a charity, or being in tune with the nature, can definitely be very, very beneficial in both preventive component as well as in terms of, so that is why especially Ayurveda talks about Shamavan. Shamavan refers to the forgiveness. See, basically what happens, many times we just get indulged in so much of criticism and so much of negative thoughts. And if one can probably learn from our mistakes, because a mistake is a mistake if you don't learn from a mistake. So probably it's very, very important that we are, as humans, to err is human, and to learn is when you go beyond humanity and enter the sphere of spiritualities. I think definitely it can add on to the whole treatment package. And it depends upon the individual preferences, and there is no one single spiritual thing that can fit for everybody. It's definitely the individual choices and the preferences that can be taken into consideration. I think Professor just add.
Mother?
So this is the term spirituality is a very broad term, and so I think it can include very many practices there. It's not very well studied in a rigorous manner in Western medicine, at least. With regards to dementia, there is some evidence that practices like mindfulness and practices like meditation might have some beneficial effects. But again, these are very small studies, and they really have not been rigorous clinical trials of such practices.
Thank you. This is a question for Professor Suhas from Professor Nirmal Surya. Is there a role of various bhasma in dementia, as some of them are known to cause dementia? Professor Suhas, we seem to have lost you for a moment there.
Yeah, I'm there.
Yes, yeah. Role of bhasma.
Yeah. See, basically there are various, as I said, there are different types of formulations. We have the herbs, we have the polyherbal combinations and herbo-mineral combinations.
Okay, I think he's having a little bit of problem with his connection. There was a question for you, Madhav, in Q&A. Let me just go there. No, and in fact, that's no, that is a question on Panchakarma. So we leave that. Can I ask you to just describe for us, because we said from Ayurveda to precision medicine, what is precision medicine when it comes to Alzheimer's disease, and how is it being practiced today?
Very good question. So there are two terms that are often used interchangeably. One is personalized medicine and the other is precision medicine. And in practical terms, precision medicine means how can I approach a patient in a manner that takes into account that patient's genetic makeup, environmental factors, and lifestyle. So how do I factor in these three key aspects of a patient and use the information from genetics, environment, and lifestyle to tailor my treatment in a way that would benefit this particular patient? So at its heart, precision medicine is something that all of us as physicians practice on a daily basis. But in terms of dementia and Alzheimer's disease, it really has not reached a stage where we would apply it in terms of doing a genetic test and then finding treatments based upon that genetic profile, because we really don't have effective treatments at the moment. So this is a field that has received increasing attention, where a one-size-fits-all approach may not work, and that individual patients, based upon their specific genetic makeup, their specific environmental risk profiles, and their specific lifestyles, may have certain treatments that may benefit them. This is a work that is still in progress. It's a hypothesis that is being tested. And eventually, I'm sure we will have evidence one way or the other whether such an approach would work, would be practical, would be economically feasible.
Thank you. We have Dr. Suhas back. So you have a few questions. Shirin Maman wants to know whether patients with Vata or Kapha doshas can drink ash gourd juice.
Basically, the ash gourd juice is said to be beneficial for the patient who are dominant with Vata and Pitta. It's more beneficial rather than Kapha. I think the patients who are dominant with Vata and Pitta, the ash gourd works better as compared with Kapha.
Thank you. There are 3 questions about Ayurveda which are combined into one. One is about how do you explain the effectiveness of Panchakarma? Which Ayurveda medicines can improve plasticity? And how do patients respond to Ayurveda? Asks Nandakumar Rao.
Basically, when it comes to the different types of the treatment that we use, and most of the often we use something called as Panchakarma. Panchakarma is like there's 5 major therapies, like which includes the therapeutic emesis, the therapeutic purgation, the therapeutic enema, the nasal instillation, and the therapeutic bloodletting. So it depends upon the dominance of the doshas that we try to plan, and it also the selection of the medicines are based on the desired benefit that you expect with these herbs. So though we call this Panchakarma, but the selection of the therapies, the selection of the herbs differ based on the intended outcome to the patients. So that is very important. And when it comes to the selection of the herbs, I think I'd give a list of many herbs which can be very beneficial in the ashwagandha, brahmi, guduchi. They are said to be a lot of research has been taken up by these works, and they're said to be very, very beneficial. But the thing is, how they work when they are used in combination with the other therapies, So that is why probably it's a time to integrate the best of the medical sciences and see that it can benefit the mankind in specific. Thank you.
Thank you. So I'm going to ask both of you to sign off with one message on Alzheimer's Day. I also want you to give us, we've talked about integration. So I want you to also include in your message your view on integrative medicine and the importance of non-pharmacological approaches. I'll let you go one after the other.
I think the time has come when we should remove all our differences and come together as a team in the welfare of the mankind. And the best of each of the medical system should be, initially we should have a dialogue of probably bringing the best of the medical aspect of each of the sciences, and also maybe take it to the higher level of generating the evidences, both in terms of the documents as well as the clinical efficacy in terms of the large studies, which are very clear methodology being adopted and the multicentric study being done for such studies. Ayurveda always strongly believes in the pharmacological as well as non-pharmacological therapies, and the whole purpose, I think we can do a lot of contribution specifically in Ayurveda, especially in terms of the preventive medicine, because if you can prepare the packages for the preventive aspects and if you can identify at the early stages of dementia, I think Ayurveda can definitely contribute a lot. And when this can be maybe integrated with the contemporary sciences and other allied therapies like yoga, meditation, and other like music therapies and other non-pharmaceutical therapies, definitely we can definitely maybe say that the quality of the life can be improved in these patients who really need support, and also addressing the caretakers. I think this is one issue I just want to emphasize, because seeing many patients, we sometimes feel that
we also need to take care about these caretakers because it can be very, very stressful taking care of these patients suffering with dementia for a longer time. So if the family can share the responsibilities, like each one in the family can take up one responsibility of the patient, and that can really help. So it's the right time that we can integrate the best of the sciences for improving the quality of life. Thank you very much.
Thank you.
So I would strike a note of hope here, Krish. Like as we've discussed, I think there is a lot that is in our own hands as patients, as people worried about a future risk of dementia. And I think all of the evidence that we've learned and has accumulated points to modifiable changes in person's lifestyle and behavior that can provide meaningful reductions in risk for dementia and Alzheimer's disease. And I think that is a strong note of optimism that we don't emphasize enough. I think there's a lot of emphasis on going after the one magic bullet, the one drug, the one expensive antibody infusion that will cure Alzheimer's disease or prevent Alzheimer's disease. I think a far more realistic approach, especially in people in low and middle income countries, in resource poor settings, is to emphasize that there is a lot that they can do today that will meaningfully produce reductions in their risk for dementia, that can meaningfully improve brain health going forward. We've talked a lot about some of those factors. So I think that is something that we should emphasize. And I think outreach activities like this have a role to play. And the more we are able to involve our patients and their caregivers in these types of public outreach and educational activities, the easier it will be to get this message across. And the more effectively we can put these interventions in place and empower our patients to take steps that on an everyday basis can improve their brain health. So that is the note of optimism and hope that I hope we can bring to our patients.
Thank you. So I think on the eve of World Alzheimer's Day, we should, sign off with a lot of hope for a better future. I think we've listened to wonderful expositions about the most modern science and the wisdom of our ancient traditions. And what this tells us is that, it emphasizes the old adage in medicine: you cure sometimes, you control often, you comfort always. And I think that, we have the potential of cure, very tantalizing on the horizon, where there are biological changes that new medicines can bring. We have definitely the disease, the symptomatic treatments that can control our symptoms. They are available to us. We've been using them. And we are hearing from Professor Suhas Sethi that they are not just in modern medicine, they are also there in the ancient science of Ayurveda. And I'm sure when we talk to other people, we'll find this in other ancient healthcare traditions. But most importantly, I think when we engage with our patients in the way that Dr. Rama so enthusiastically described, we are able to work with them, and as Professor Suhas said, with the caregivers, and we are able to influence their lifestyle, as Professor Madhav Tambisetti has been emphasizing. I think there is hope for all of us that even if we don't prevent the onset, even if we can't cure the problem, we can slow it down, we can make it far more bearable to people and their families. And I think that really should be our message of hope. So from Ayurveda to precision medicine, thank you both, Professor Suhas Sethi, thank you, Professor Madhav Tambisetti. And, from Buddhi Clinic, it's been a great pleasure for us to host this program today. Thank you all.
Thank you very much.
Thanks a lot. Thank you, Dr. Rama.